At Pabau, we are always looking for ways to improve our videos. Please like, comment, and subscribe to stay in the loop with new content. Hi, I'm Ivana, one of the senior medical content writers here at Pabau. A PRP therapy treatment form is a clinical document used to record all key information related to platelet-rich plasma treatments. It exists to capture patient medical history, suitability assessment, blood collection details, centrifugation parameters, treatment areas, consent, and outcomes. This form creates a clear, traceable record of care and supports safe, consistent clinical practice. This form is important because PRP therapy involves blood handling and re-injection, which carries clinical risks if not managed correctly. Patient health status, medications, bleeding disorders, and infection risk must be carefully assessed and documented. Accurate records support patient safety, regulatory compliance, and professional accountability, while also helping clinicians evaluate treatment effectiveness over time. In clinical practice, the PRP treatment form is completed during consultation and updated on the day of treatment. It guides the practitioner through patient screening, confirms informed consent, and documents the blood draw, processing method, and PRP application. It also records treatment indications, such as skin rejuvenation, hair restoration, or joint support. Before and after photographs are often taken and stored with the form to objectively track progress across treatment sessions. Key considerations include confirming patient suitability at every visit, as medications or health conditions may change. Precise documentation of blood volume, centrifuge settings, and injection technique is essential for safety and reproducibility. Common pitfalls include incomplete consent, unclear processing details, or missing documentation of post-treatment advice, all of which can compromise care quality. Step 1 is to complete the patient's personal details, medical history, indication for PRP, and suitability assessment during the consultation. Step 2 is to confirm informed consent, explain the procedure and risks, and take clear pre-treatment photographs if relevant. Using a clinic software such as Pabau. Step 3 is to document the blood collection, processing method, PRP volume, and treatment areas during the procedure. Step 4 is to record post-treatment response, aftercare instructions, follow-up plans, and attach post-treatment photos when appropriate. In summary, a well-documented PRP therapy treatment form supports safe procedures, consistent outcomes, and high standards of patient care. Visit our website where we have over 6,000 free templates and resources to choose from.